This room is truly about saving lives. This is where the sickest of the sick come.
Dr. Paul Linden doesn't beat around the bush. The trauma room at the emergency department of KGH is the last place you want to be. But as a last line of defense, it's also your best chance for survival. And now, with some new equipment, those odds of surviving just increased.
Emergency medicine is about ABCs, airway, breathing, circulation. We keep it simple. It's the things that are going to kill you the first and the fastest. That's your airway. You lose your airway, you have minutes, okay?
One of the jewels as far as the new equipment is the airway. It's called a CMAC arm. So if you get to the point where you're not breathing and we have to put a tube down to help you breathe, this airway actually has a camera on it. So if we have a resident and we're teaching them how to do it, or if they're watching us, this gets shown on a big screen TV, a flat screen TV. Nobody has to really crowd around the patient. So it's going to be wonderful for teaching. It also is a lot easier for us to actually be successful at getting the airway.
So now you see the epiglottis, you see the vocal cords. That is so important to be able to see and recognize. Because if you don't, that will be the difference between life and death for this patient.
We've got the ultimate preparation in this room in terms of having everything available and ready to go, which in turn just speeds up the resuscitation and at the end of the day makes a difference, because the patients we see in there are truly the sickest patients.
I can actually record this. Push a button, I'm recording this process so that we can examine it later and teach from it later. The stretcher itself was also a great addition. It's more than just a stretcher. It actually has a scale on it, so when we have big patients, we're not sure they're going to fit in the CT scanner or not, we can actually weigh them and find out how much they weigh. And instead of having to pump the bed up, now it's all electronic.
We had good devices, but this particular device incorporates so many aspects of traditional approach to airway management, direct laryngoscopy, along with the video laryngoscopy, which is sort of the up-and-coming technique that we use for difficult airways.
The other piece of equipment we have is a state-of-the-art ultrasound machine. Ultrasound machines are wonderful these days. They're no radiation. We can tell if you have some blood in your belly, if you have a collapsed lung, if your heart's beating. We can tell if you're pregnant, all kinds of different things.
So there's my carotid. See that big black vessel in the center of the screen? Okay? And it's hard to find the veins sometimes. See how close they are? I do not want to stick a needle into that vessel. I want to stick a needle into that vessel. So you can see how this device is so incredibly useful for that.
Trauma 3 is located on the first floor of the Centennial Building at KGH and is part of the emergency department. Joining the specialized airway ultrasound and digital imaging equipment is a hyperhypothermia system, which can warm or cool patients at a controlled rate.
People who have had an arrest, a cardiac arrest, it's a standard of care now to cool that patient for a period of time because they have better outcomes in terms of their brain. So we have the ability to start that cooling process in the emergency department for a post-arrest patient, but we also have the ability to warm up our cold trauma patients, our hypothermic patients.
Charles Fipke is the man behind the money for the new equipment. The diamond magnet and horse breeder set up Canada's first diamond mine, and his horse Golden Soul finished second in the 2013 Kentucky Derby. But he never tires of philanthropy and is thrilled to make this donation.
You know, it's very exciting when you see the demonstration and all the fantastic innovations that they've come up with. And right now it's state of the art. Maybe in 2 years it won't be, but right now it's the best you can get.
The Charles E. Fipke Foundation paid for everything in that room, and it was just under $1 million. But its impact in our community is priceless.